Hello, everybody. I am so pleased to introduce Dr. Thomas from Germany. He's been practicing both Eastern and Western medicines, and he's combining to help so many. So please, Dr. Thomas, please introduce yourself. Thank you.
Thank you for invitation. First, I want to apologize that my English is really not good. So just take it as an exotical German dialect. I don't know. When I learned English at school, this is a really long time ago, and this time I had my first language I have to learn was Latin, a dead language, and not a language which is still existence. So I'm sorry for this. Yeah, I'm very happy and glad that I can tell to you. And maybe you have some questions and what you like to know about me, and just give me some hints.
Yes, please tell us how you started your Shiatsu journey. Mm. Why did you fascinating about Eastern medicine?
Okay. So the first contact was in the beginning of the 80s. I was working for 3 years in the Philippines and doing a field work, a research about traditional medicine in the Philippines. And when I came back, I was on a festival. It was a New Age festival, and
Mm.
on this New Age festival, I saw a woman presentate. She presents shiatsu treatments, how it looks.
Oh,
And I was watching her, and then I thought, could be nice to come in contact with her. Maybe she gives me an example on me.
wow.
So then after this, I decided to start with shiatsu education. I started to learn the shiatsu. And well, my teacher in shiatsu, later, we married my wife. Yeah. So that was in the 80s where I learned shiatsu. And my wife, she opened for me the gate to the Oriental medicine because
Oh,
while I was in the Philippines, at the same time, she was for a couple of years in Japan and
oh,
learning in Japan shiatsu and teaching there. So somehow we came together, and now there
oh,
were
I
like
see.
two energies coming together and developing something new thing. Yeah.
Wow.
Um, I then after I learned the shiatsu, then I started in learning acupuncture. Uh, I
Mm.
learned the here in Germany when you learn acupuncture is the traditional Chinese medicine.
Mhm.
Acupuncture is a Chinese kind of acupuncture, but this was for me only not really satisfying. So when the next time we came to Japan and we were traveling more or less every year to Japan, um, I learned Japanese acupuncture.
Oh, I
And this
see.
opened for me those those special things which are different from the Chinese way,
Mm.
like palpation.
Oh, I see.
Yeah, like in Shiatsu with the Hara diagnosis, you
Yeah.
were diagnosed by palpation with your hands. And this
Mm-hmm.
was something new for me because in the Chinese acupuncture, well, you use your hands for pulse diagnosis, but it's not so sophisticated.
Oh,
And
I see.
I felt much more
Mm.
comfortable with this
Mm-hmm.
Japanese way of creating a diagnosis by
Oh.
patient. Hmm.
Mm.
Yeah,
And
that's
also in Japan, we use such a thin needles.
that's right.
Mm.
Much more. The needles are much more thin.
Yes.
You need sometimes a tube because they are so thin that you need a tube which is around the needle that the needle won't. Otherwise, you can't penetrate the skin.
Yes.
Yeah.
Right. Right.
Really very fine needles,
Oh,
very
Oh,
nice. I like them very much. Yeah.
I see. Oh, that's
But
great to hear. I
yeah.
didn't know that there was Japanese specialties.
Oh yes. Oh yeah.
Ah.
Yeah, but
Mm-hmm.
needling is one thing which
Mm-hmm.
I is for me no problem. I like to make it to perform the acupuncture, but I also have a lot of patients who are not adults, they are children. And
Mm.
I'm a general practitioner, but I'm
Yes.
also I have also the training in pediatrician,
Mm.
general and pediatrician.
Mm.
From year to year, my patients, the number of children as a patient was
Yes.
growing. And to be honest, my passion are the children.
Right.
Yeah.
And then it's kind of hard to do the thin acupuncture treatments for the children because they cannot sit still.
It is
And then
right.
you met the Shōnishin.
That's right. That's how I
Oh.
came to Shōnishin. I mean,
Mm-hmm.
fine Japanese needle, you can do the acupuncture with children because it's
Mm-hmm.
really painless. But children are so sensitive that
Yes.
just the the even if it's a painless penetration of the
Mm-hmm.
skin, it is very often too much stimulation. So
Yes.
very easy they are overstimulated.
Ah.
So I was so happy that one day I read an article
Yes.
about Shōnishin.
Yes.
And so I decided the next time when we go to Japan, I want
Mm.
to learn Shōnishin. But at
Yes.
first, I have to meet the one who is teaching Shōnishin, and that is Tanioka Sensei in Osaka.
Mm.
And he is in Japan, I think let's say the Shōnishin Pope.
Yes.
And
Yes.
he's very well known. And when I came in contact with him,
Mm-hmm.
I felt also something like there is a inner bondage between him and me, something
Oh,
like
wonderful.
that.
Wonderful.
And so I learned Shōnishin, and so he was teaching me Shōnishin.
Mm.
And since that time, I
Mm-hmm.
was, let's say, infected.
Mm. I
Yeah.
see. And
Mm.
how do you describe Shōnishin for the
Hmm.
people who doesn't know about it?
Oh, I can show you.
Yes. Yes.
Yeah. In Shōnishin, you
Mm-hmm.
with different kind of tools.
Yes.
Oops. Here, different type of tools, but
Mm-hmm.
the different types of tools are different because to be able to perform different kind of stimulations.
Mm-hmm.
But for me, this was not really something which I felt comfortable with this,
Mm-hmm.
because if you do, if you perform one kind of technique and then you have to change the technique because to make another stimulation, then you have to put the instrument away, the tool away, and grab another one.
Mm-hmm.
It means interruption of your treatment.
Mm.
But children are very sensitive. So when you
Yes.
interrupt your treatment, they don't like it. It's like me. When somebody gives me a good shiatsu,
Uh-huh.
best shiatsu would be my wife. So if she would give me a shiatsu and during treatment, the,
Uh-huh.
the smartphone is ringing and she will say to me, "Oh, just a minute. I come back in 1 minute." For me, it's over. Yeah,
Right.
because
Energy shuts down. Yes.
there's not anymore a flow.
Mm.
Energy,
Mm.
energetic flow is interrupted. The treatment
Mm.
flow is interrupted, and children taught me this.
Ah.
Especially babies taught me because they are not manipulative. They are, let's say, they are just direct.
Yes.
They express what
Mm-hmm.
is going on, And so at least the babies and little children were, besides Tanioka sensei, my real teacher. Okay, so I was thinking of creating a tool,
Yes.
just one tool to perform with one tool all kind of operations, and that's the one which I created. And
Wow.
this tool looks very simple. I can do any kind of treatment method, yeah, any kind. So that's one point for me important. The other point of me was maybe you with Japanese background, you know, when you learn in Japan some, let's say, acupuncture, shiatsu, you you watch and you try to imitate, right?
That's how we learn. Yes.
And you don't ask so much why and what is it, because if you ask some sensei why does it work, he will say because. It's always like that. But I'm not Japanese. My teacher, the Tanaka sensei, he said that's the big chance for Shōnishin because the first time that a medical doctor Shōnishin and he's not Japanese, so somehow as a gaijin, I have some kind of uh, free status, yeah. Some, and he said, well, with my not background knowledge, I should look what we can do with Shōnishin.
Oh,
And so
wonderful.
I was come back home. Um, I was researching why, for example, certain kind of treatment on the skin, why the children uh, are coming in a deep relaxation. So I found the gap between energetic treatment and neuroanatomical sound, which explains what is going on. So I was looking on the things behind it. So I wrote a book, also one in English. This is
Wonderful.
Shōnishin, the
Great.
art of non-invasive pediatric acupuncture. And in this
So,
book, I
mm,
wrote something about this.
so you use Shōnishin for the babies to everybody,
To anybody.
teenager or elderly people, everybody.
Yes.
And did you find some acupressure points very effective for those?
That's acupuncture thinking.
Mm-hmm.
Our thinking is
Yes.
more about if a baby or a toddler or a teenager or an adult person has some certain problem or
Yes.
symptom, we look what was the energetic precondition and when did it happen that a problem could manifest itself. So the treatment is giving support to an energetic level which was maybe years before. So just for an example, a school girl with asthma bronchiale comes
Yes.
to me and wants some treatment. Then I have to look when did it start first time. And when she said, sorry, it started around when she was in kindergarten, so she was 4 years old. Then I know at 4 years you are in a certain energetic development because all our meridians, and that's what Karen and I were researching the last 35 years, that the meridians have a development, well, are developing also like motor skills, like sensory skills. So
Mm-hmm.
also energetic skills and meridians, they
Mm.
kind of development. And uh, in the age of, let's say, 4 years, there is a certain kind of combination how meridians are working to each other,
Mm.
which will be changed when they are later. So on this level,
Mm-hmm.
find out how the meridians, which meridians and how the meridians
Uh,
will be uh, get some support. That's the way how we enter into this.
oh, I
How
see.
that's a basis of our treatment based on this kind of diagnostic. We call it the energetic development.
Mm. Interesting. And Karen told me you and Karen are working with the refugees from Ukraine.
That's right. I started.
Please tell us about it.
Yeah, that's. I mean, we have now more than 1 million refugees alone from
Mm.
1 million, yeah, over 1 million,
Mm.
and they are women, yeah, and
Ah.
most of them have children. So you can imagine how many children we have, and of course, there it's a tragedy. Um, so many of those children they are deeply traumatized,
Mm.
and I was remembering when they're in Japan, the
Yes,
problem with Fukushima, and yeah,
yes,
uh, and the tsunami was that my Shōnishin colleagues in Japan, they
Mm-hmm.
to Miyagi, and they were helping the children with Shōnishin.
Mm.
So I was contacting my teacher, Tanioka Sensei,
Mm-hmm.
that was also the head of the Japanese acupuncture pediatric acupuncture society, the
Mm.
Nihon Shoni Hari Gakai,
Mm-hmm.
uh, and they sent me some information what they did.
Oh, I see.
So this information but I put it also with my uh, experience when because I'm for a longer time I'm working with traumatized adults, especially
Mm.
those who have a trauma uh, uh, caused by the
Mm.
birth trauma. So Karen and I, were thinking, what can we do? And so I use Shōnishin now in the treatment of the traumatized children from Ukraine,
Mm-hmm.
combined a little part of the baby Shiatsu, which Karen
Mm.
invented, or which
Yes.
Karen practicing and teaching. Um,
Mm-hmm.
uh, because the technique of the
Mm-hmm.
baby Shiatsu, uh, a certain kind of treatment, that's the hand treatment. And this hand
Oh.
treatment gives me a big chance. The chance is the
Oh. I see.
children who are traumatized, they
Mm.
are something like frozen.
Oh,
Yeah, they
interesting.
are not anymore living in their body. They
Mm.
they need this frozen status to stand this terrible situation.
Mm. Mm-hmm.
So we call this dissociation. They're dissociated.
Mm.
And if you treat somebody with
Mm-hmm.
traumatized and is still dissociated, then you make his uh, his yeah his you make just the contra the
Mm-hmm.
the how do you make the opposite of what you want. It's not
Oh.
good to treat people who are dissociated. It makes the dissociation and this freezing to be freezing much worse. So
Mm.
I have to bring the children back in their body and that they are here in the room where we are now at the moment sitting. And this hand treatment, this helps a lot. So the children come back and suddenly they feel the hand and they have interest on the hand, look to the hand, come in a are relaxing, and then I start with different Shōnishin techniques, which are very simple, and it's a very short treatment what I do. So when on 22nd, when we are again on Zoom, and if you want, I can show you a PowerPoint, which a PowerPoint first part where I make an introduction to Shōnishin.
Yes.
What is Shōnishin?
Yes.
What's behind it? And then I show the second part, how I'm treating the children, what's behind this, so to make it much easier and clearer.
Wonderful. Thank you so much. I'm looking forward to it. Thank you.
I thank you for the opportunity.
Oh, of course, of course. I'm so happy. Thank you so much. And we look forward to seeing you on October 22nd.
Great.
Thank you.
Welcome, welcome.
Thank you so much.